My name is Genevieve Barnard, and I'm the co-founder and CFO of MDaaS. And MDaaS, we've been working together for a little over 2 years now, and our company is building critical health infrastructure to provide healthcare for the next billion people on the continent of Africa. And we've started our work in Nigeria, building diagnostic and primary care facilities. Right after my undergraduate studies, I moved to Uganda, and I worked with a program there and spent a lot of time in public hospitals. And one thing that I realized was that a lot of these facilities really struggled to get the equipment and the expertise that they needed to provide care to their patients. And I grew up in Boston, Massachusetts in the United States, and I was thinking back to when I was a kid and the type of healthcare that I had so readily available to me. If anything ever went wrong, my mom was pretty overprotective, so any small thing, and it was like, okay, bring Genevieve to the doctor. And realizing that that same level of care wasn't available in a lot of the areas that I was working just seemed really unfair at its core, and it seemed like something that it would be worth dedicating a life to. And I met my co-founder and husband, Shoga, a couple years after I'd had this experience in Uganda, and he grew up in Nigeria. His dad's a medical doctor who has run his own hospital for over 30 years now. And his dad had struggled with a lot of those same challenges around access to quality equipment and access to expertise on running and managing hospitals. And so we joined together with our two other amazing co-founders to see how we could really tackle this issue, starting in Nigeria, because that's where we had a lot of strong connections through Shoga and his family there. I think one of the biggest things that I've gotten out of this is the community that surrounds the GSBI and the GE cohorts. So we've made a lot of really interesting connections with the other entrepreneurs and with some of the mentors that are in the network. And that's been really valuable for us. We were at a point where we were pivoting in our business model when we started this program. So we were really looking for feedback and looking for experienced fellow entrepreneurs and mentors to be able to help us through this transition period. And I think we really got that through the program, and we're able to learn a lot and have a lot of support throughout this process. And it enabled us to open our first diagnostic center during the course of the program. So that was really exciting to kind of have these lessons that we were learning through the curriculum and then actually get to experience it and deploy those in the field with our first diagnostic center.